Thanks everyone for taking time out of your busy schedule today to talk about HF10 technology as it pertains to spinal cord stimulation. First, want to give you, a lot of you already know me, but let me give you a brief introduction. My name is Dr. Stephan Parker. I am one of the pain management physicians for OrthoSC, the recent merge ortho group for the Myrtle Beach area. I began practicing in Myrtle Beach in 2011 and am a graduate of Howard University in Washington, D.C. There I received my Bachelor's of Science degree in molecular biology and then went on to matriculate at MUSC, or the Medical University of South Carolina in Charleston. I finished medical school there and went on to perform a internal medicine internship and later a physical medicine and rehabilitation residency at the University of Pittsburgh Medical Center. I practice as a physical medicine rehabilitation physician where I was a neuroscience director. I also cared for stroke patients and musculoskeletal injury patients for the better part of 20 years, and then decided to change my spots, as it were, and go into pain management. I did that at Marietta, Georgia at non-surgical orthopedics, joined Carolina Orthopedics, which brought me to the Myrtle Beach area in 2011, and have been practicing here ever since. Some of my other interests are telemedicine. There's a company by the name of MD Live that is one of the top 3 telemedicine companies in the country, besides American Well and Teladoc. And that is, of course, growing by leaps and bounds. Telemedicine, a lot of you have probably seen it or been hearing about it of recent because of coronavirus, and as a result, we believe it's here to stay. I am married to my wife, Camilla, have 2 children, and have several interests that you can see here in the About Me section. About OrthoSC, again, OrthoSC was really the merger of 3 orthopedic groups here that were non-hospital affiliated, that being Coastal Orthopedics, Carolina Orthopedics, which is my old group, and Strand Orthopedics. We are 23 physicians strong, in addition to several PAs and other ancillary staff. Our care team is dedicated to offering the most advanced evidence-based treatment for orthopedic and musculoskeletal conditions, for that matter, to serve our respective communities. We have durable medical equipment. We perform EMG and nerve conduction studies. We have MRI, physical therapy, and X-ray. Next, this presentation, just a disclaimer, is jointly conducted by and all related materials developed in collaboration with Nevro Corporation, the maker of HF10, which we'll get into a little bit more. All right, so once you decide that HF10 is something, or anything that OrthoSC offers is something that you might be interested in, of course, there would be concerns regarding how we are keeping you safe as a public in this age of the coronavirus / COVID-19. Well, one of the things is what I just got through alluding to was we are prioritizing telemedicine. I've been performing and have been a part of telemedicine since 2004. And so this was like riding a bicycle for me, but the practice as a whole has recently adopted telemedicine protocols, and we do have appointments that could keep you from being exposed to others if you have pre-existing condition and the like. And so we have that. If you need it, we have new office protocols in advance as well. Pre-visit phone calls to answer any questions and set expectations. Regarding our protocols, we have patient screening questionnaires, both pre-visit and upon your arrival to our office, to make sure that you are safe and not, as much as we can know, not a carrier, and certainly not putting anybody at risk, and then vice versa, making sure that other people who were screened are not putting you at risk. We do have the ability to complete paperwork electronically. Most of you who are already OrthoSC patients are probably familiar with the portal. where you can enter your information and we can communicate with you all from the convenience of your home on your computer. New office protocols during your visit include all patients are required to wear masks as well as physicians and staff. We do temperature checks before you enter our building. And the physicians and staff are also required to do temperature checks before they start their day. We continue to do the screening questionnaires. We have a limited capacity in the waiting room. And some of you may have already run into this where we've asked your significant others to remain in the car in the parking lot so as not to inundate our waiting rooms and the exam rooms with too many patients so that we can maintain social distancing. And then if you are in the car, we're able to text message you to let you know when your loved one is ready to leave. Next, what is pain? So pain is the way the brain interprets information about a particular sensation the body is experiencing. And I can't see who's participating in this particular seminar. However, many of you, if you've been in contact with me, if I've cared for you, heard me say this, that I liken the sensation of pain or how pain works in the body to a electrical wiring in your home. The brain being command central, the spinal cord being the breaker box, if you will, and then the individual wires going to the various rooms being the nerves. So the information is sent to the brain via nerve pathways. The way that the brain interprets this information is very complex and can be affected by many outside factors like stress, to name a few. Pain can differ enormously among individuals. There have been studies taken for even different societies that their interpretation of pain, some societies don't have as many pain complaints for similar problems as do others. Industrialized nations, of course, probably having the most issues with pain more so than others versus third world countries who are having to endure a lot of adversity so that pain is not as great of a setback for them, as well as we know that there are genetic factors that determine your interpretation of pain versus another person. Pain is multidimensional, as I've just alluded to, physical, mental, and emotional components. Next, chronic pain. What is chronic pain? Chronic pain persists for several months, usually within 2 to 3 months. And if you're still requiring help with pain, then you are by definition a chronic pain patient. It can be caused by injury, infection, or an ongoing ailment. Ongoing ailments could also be chronic conditions like chronic herniated disc, or if you have had surgery in the past to your spine, be it neck, thoracic, or low back, that would be chronic as well, because obviously there are always responses that the body has when you have undergone those particular procedures. Pain also often has emotional side effects that can include depression, anger, and anxiety, and I briefly mentioned that too. And it is a well-known fact that stressors in your life can exacerbate your interpretation of pain. Chronic pain, we know, is an epidemic in this country, and for that matter, the world. But we'll speak to the US in particular. Roughly 8% of the adult population suffers from chronic neuropathic pain. Neuropathic meaning that the origin is some insult to the nerve. Pathy, condition of the nerve. The majority of this is chronic low back pain. And this is either from industrial accidents or sports activities, or just living life in general and making the wrong move, causing an issue there. The annual cost of chronic pain in this country is about $600 billion. So with the chronic pain patient, what are the approaches? Well, certainly, if you look at the top section of this slide that you see here, pharmacologic therapy, which everybody's heard about this, and quite frankly, we're trying to get away from this being a mainstay in the treatment of chronic pain secondary to the opiate crisis. So I think years ago, there were certainly uh, attempts to control pain, and actually doctors were mandated that if a patient did present to their office and they had pain, if the physician he or she did not adequately treat the pain, that they would be brought up on sanctions with their respective boards. Fast forward, and this was probably in the 80s when this happened, fast forward to the 2000s when the opiate epidemic, quote unquote, hit, then doctors were being persuaded and certainly strongly encouraged not to treat with opiate therapy as it has become out of control. Certainly lifestyle changes are another treatment modality, loss of weight, engaging in exercise, and refraining from activities that might bring stressors to the spine in particular, as an example, that might help with pain resolution. Physical therapy being another first line treatment to try to combat pain. In my mind, physical therapy can be a treatment, but more likely and more often than not, it really is more for maintenance once pain has been treated in whatever way. Second tier would involve nerve blocks. This is getting into my part of what I do with in the continuum of the management of pain. Nerve blocks by form of injection, epidural injections, which I'm sure several of you in this particular seminar have undergone, and other injections like radiofrequency lesioning, to name one. That leads us to the third tier, more significant modalities and treatment protocols once pharmacologic therapy, lifestyle changes, physical therapy, epidurals, nerve blocks, and other injections just have not worked. Spinal cord stimulation, which the HF10 falls under, is therapy used for diagnosis considered, or called rather, failed back syndrome or post-laminectomy syndrome. This implies that you've undergone a procedure and despite your best efforts and despite the best efforts of the surgeon, that a patient still experiences a significant amount of pain. And so a device like a spinal cord stimulator certainly can be placed in and near the spine, which is meant to change the pain message as it travels to the brain to something more pleasant. Next, certainly last ditch efforts would include surgery in certain forms, depending on what your diagnosis is, and after having failed tiers 1 and tiers 2, and then pain pumps. Now, pain pumps are not as in vogue these days because there are a lot of complications with pain pumps. One of which is sometimes if the pain pump malfunction, you could get an overdose of the medicine that you were receiving and cause some issues for you. Next, what is spinal cord stimulation? Spinal cord stimulation is an established safe therapy that involves the delivery of energy to the spinal cord through small wires in the back. Most of the spinal cord stimulators, as you see that what is the battery to your right and bottom of the screen, generates energy that travels through the wires that you see there, and it generates an impulse to the spinal cord. And so that as it competes with the pain message, as it tries to reach the brain and turns it into something more pleasant. Now, what you'll hear later about the Nevro HF10 technology, it's a little bit different experience for you, although where it works is generally in the same areas. Spinal cord stim has been around since the 1970s, and like the cell phone, obviously it's gone through several iterations and development as technology has improved, and so has spinal cord stimulation, in my opinion. And spinal cord stimulation is typically prescribed for the treatment of pain in the back, trunks, and limbs. So what is HF10 and how is it different than traditional spinal cord stimulation? So HF10 technology is an advanced type of spinal cord stimulation therapy that has been shown to deliver long-term significant pain relief. It offers more pain relief to more patients when polled, and when studies, and this is what some studies have revealed. Controlled trials have shown that 80% of patients achieve 50% or greater pain relief 12 months or more. Traditional spinal cord stimulation, that offered by St. Jude's, Boston Scientific, and the progenitor of spinal cord stimulation, which is, why am I blanking? We're actually with St. Jude's. So we would see 50%, but there would be some issues with longevity after some, like let's say more than a year. And HF10 is showing to be more consistent with more long-term pain relief. We know that it's highly effective for both back pain and leg pain. And as you saw in the video, even though you probably couldn't hear it that well, the FDA has approved this. It is paresthesia-free. What are paresthesias? Well, if you have any friends who've had spinal cord stimulation, they report a buzzing or a vibratory sensation. Paresthesias or for lack of a better word, or like a tingling. Now, tingling versus sharp pain, which would you prefer? I mean, obviously, I know I would take tingling over pain, but the HF10, as you'll hear about, does this without any of that. And so it might, for some, be a better experience. And you can use it 24 hours, 7 days a week. The Nevro spinal cord stimulator is the only system that offers HF10 programming. Now, what is that? It's high frequency 10,000. Now, I know some of the other companies tout that they do have high frequency, but they're doing it at a lower frequency than the Nevro technology, which is 10,000. And most research has shown that the true high frequency programming needs to be at the 10,000 hertz that you see here. It can also deliver low frequency stimulation alone or paired with HF10. It's conditionally approved to have full body MRI. It has a rechargeable battery designed for rapid charging, and the battery life should be somewhere around 10 plus years. It touts superior long-term pain relief. A large clinical trial demonstrated HF10 offering the highest success rate, helping more patients return to everyday activities. HF10 patients also achieve more pain relief at the 2-year mark versus its competitors. It's superior pain relief, more freedom, less burden, freedom to move without tingling, a prickling or buzzing feeling. This is also the only spinal cord stimulation that you can use while driving. There are no restrictions with sleeping. Some of the other, its competitors rather, has a remote control, and this eliminates the having to use a remote control for daily usage, and the charging capacity, it's very seamless with how you charge the stimulator. So what are some of the facts about HF10 spinal cord stimulation? How does the procedure work? Well, there's a temporary trial. And so if there's anyone on the call right now who's had spinal cord stimulation with some of the other companies, you know that we usually place the stimulator in your body and have you, quote unquote, test drive it for 5 days. Well, the Nevro technology is the same way, where you would wear it for 5 to 7 days to determine whether it's something that you'd want to proceed with, and then ultimately have it implanted permanently. Is it safe? The HF10 technology safely delivers stimulation that doesn't interfere with normal sensory perception, cognitive abilities, or motor function. When the HF10 device is placed in your body, you still have the ability to sense normal sensation, so it does not replace one for the other, just so you know. Will you feel anything? Well, herein lies the difference between traditional spinal cord stim and HF10 spinal cord stimulator. You don't feel anything other than you notice an elimination of your pain. The stimulator, the HF10 technology has what is called a washout period, where little by little, because of the 10,000 hertz that your spinal cord is being challenged with, the pain is eliminated little by little until you have little to no pain left as long as the stimulator is in place. Is the trial procedure reversible? Yes. So just like you would experience with the traditional spinal cord stimulator, after the 5 to 7 days, we remove the leads. And it is at that time that you decide whether you want to proceed with permanent placement or not. And if so, then we would arrange this with one of our surgical partners to have this placed. Can I turn the device off if I need to? Of course. It just as in traditional spinal cord stimulation, you have a controller that gives you that ability to turn off the stimulator or the remote control. And then, as previously mentioned, this is a whole body MRI compatible device, unlike its competitors. We have some numbers that you can see here from our practice, what we've experienced having used the Nevro technology versus some of the others. Now, I don't have comparables with the other companies, but with the Nevro at least, there's been on average 51% decrease in medication usage, 76% improvement in sleep, 82% improvement in overall function. That includes activities of daily living like dressing, cooking, cleaning your home, as well as recreational activities. 81% of patients achieve long-term relief. And so we're talking greater than a year and upwards of 2 years or more. And 82% of HF10 patients using your programs unique to, or are using programs unique to HF10 technology. The local patient experience, obviously we've treated quite a few patients in the area, and one of which is this lovely couple that you see here. And they felt that, you know, having performed and followed through with the HF10 technology, they are back to life, enjoying football games at Coastal Carolina, going for walks in the park over a half mile, not having any problems with steps or bleachers. Right, so patients are more free to get back to things that they enjoy with the HF10 technology. Here's Brock to your left, tried multiple pain therapies to achieve relief, but wasn't reaching his treatment goals. Felt like he was out of options after having done the and followed through with the HF10 technology. He reports 85% relief in his pain. Chronic pain prevented Helen from doing even the most ordinary tasks, and she's to your right here. She was forced to sit with her legs elevated and stay comfortable in almost all situations. Again, post HF10 technology, 80% relief. So in conclusion, chronic pain is a chronic problem for many people across this great country of ours. Many treatments exist, including the spinal cord stimulator. What we believe about HF10 is that it's an advanced form of spinal cord stimulation, and that more pain relief without the tingling can be achieved versus other spinal cord stimulation devices. So with that, if there are any questions, we are here you can respond to us and we can try to answer some of your questions. Now let's see. Okay, so the question is, what are the physical limitations, if any, after the trial period? So after the trial period, there are really no physical limitations if you decide not to go through with the spinal cord stimulation, i.e. the HF10. If you decide to finish with the HF10, some sports you are still able to participate in. What we discourage though is contact sports. So if you are a recreational hockey player, if you play flag football, anything like that, that might not be the best of sports to engage in. But certainly bowling, pickleball, tennis, sports like that, golf certainly, you would be able to participate in post HF10 implantation. So the question is, what if any drawbacks or negative aspects are there for the HF10 technology? Well, I will tell you that like all of the spinal cord stimulation technologies, it's either going to work or not work for you. In this one in particular, because it is whole body MRI, you don't have that as an impediment to future care. With the traditional spinal cord stim, I think some of them are have been approved for the head, but not the low back. And so then the CT scan technology would be appropriate in those particular cases. But again, the HF10 technology is full whole body MRI compatible, so no issues there. It's either going to work or not work for you, and so that's the purpose of the trial. And then obviously there's always a chance of infection post-procedure. Anytime you introduce something from the outside to the inside, then you certainly there's a risk of infection, albeit minuscule. I have another question. Can the stimulator cables be removed following the permanent implantation? And the answer is yes. Both with traditional stem and HF10, if you decided that for some reason it's just not something that you want to continue with, then the cables can be removed. Next question is there an age limit to doing this procedure? No, not really. I mean, with surgeries in general and procedures of this kind, if you have the heart and lung health to undergo procedure, then we're really not concerned about your age, more so your health pre-procedure. We haven't used this. I'm not aware of any pediatric cases requiring this, say for spinal cord injury after, let's say, an accident, MBA, or a childhood injury of some kind. But for the purposes of argument, because I don't know, let's just say that, 18 and older, this would be appropriate technology depending on what your problem is, and the sky's the limit based on heart and lung health. So next question is, being a paraplegic, will it stimulate the damaged muscles in a spinal cord? Well, let me just kind of help with that. So number one, there are no real muscles in the spinal cord. The spinal cord is a collection of nerves, and it serves as the pathway with which nerve impulses travel from the extremities to the brain and then back again. So as a paraplegic, I don't know, I mean, so this being for the purposes of low back and lower extremity pain, most paras wouldn't be experiencing that, other than with the occasional, let's say, dysesthesias, which is pain in a fresh para. But most paras I know, they combat spasticity more so than pain. And so the spinal cord stimulator would probably not be appropriate therapy in that particular case. But no, it does not damage muscle around the spinal cord. Next question, is it covered by Medicare? Yes. Next question, is the HF10 only for low back, arm, and legs? Does it provide any relief for neck pain? So like traditional spinal cord stim, you can place the leads in a position that would help with intractable neck, shoulder, and arm pain. It's based on placement. The HF10 technology requires that we place the spinal cord stimulator in a staggered pattern at the 8th thoracic and 9th thoracic vertebrae. If the neck and shoulders or arms were to be covered, you would have to place the lead or the wires, if you will, in the neck area. Can diabetics have this procedure done? Yes. There is no contraindication to having HF10 technology placed in diabetics. As a matter of fact, spinal cord stimulation in general is technology that is being looked at more and more for diabetic peripheral polyneuropathy that is not responsive to medications. How often does it need to be reprogrammed? Well, that is patient dependent. I mean, it depends. I've seen patients reprogram monthly until they find the right settings for themselves, up to patients who only have to be reprogrammed maybe once or twice yearly. So it is definitely patient dependent. How do you qualify for a trial? Can you travel and fly? And so qualifications for the trial are basically set by the insurance companies, believe it or not. Like everything else these days, when your physician determines that you have the diagnosis that qualifies for you, this again, we mentioned it briefly earlier, post-laminectomy syndrome, failed back syndrome. That means you've had surgery in your low back and or neck, and despite your best efforts, you still have chronic pain complaints, that you may be a candidate for the spinal cord stimulator. You would have a identifier, much like a pacemaker, so that in the security check, you would be able to fly and travel with the spinal cord stimulator. But once you have the qualifying diagnosis to undergo spinal cord stimulation, the trial would be performed, because the other thing is the insurance companies won't pay for the permanent placement unless you have sufficient pain relief from the trial. And in general, the question is, how do I get an appointment, and do I have to have a referral? Again, insurance dependent, but in general, yes, to be on the safe side, to make sure that your insurance covers this, I would obtain a referral from your primary care physician for evaluation for spinal cord stimulation, or if you have already set up with a spine surgeon and you've been having these issues, then that physician could also make the referral to our office to have you evaluated for spinal cord stimulation. Where's the procedure done? By me is what the question is, and are you easy to get in to be seen? So a couple of answers to that. The procedure can be done in an office setting, and it can also be done in the surgery center. In these days of COVID-19, most people are trying to stay away from the hospitals because of the amount of people in the hospitals. Surgery centers, however, or a mini form of a hospital, if you will. We have all the lights and the cameras and the action and surgical staff that you would see in a hospital, but at a lesser scale, so that we're able to maintain the distancing, and we don't have near the number of people coming into our facility for treatments and surgeries and the like. And so surgery centers, much safer situation, especially right now. Same protocols that I mentioned earlier are being implemented to assure your safety. We try to, from an appointment standpoint, all the physicians at OrthoSC, we now offer same day appointments. And so once you got your referral, if your desire was to see me as an example, once that was approved, you could see me same day, if necessary, or certainly within a week. Let's see, another question is, where's the procedure done? Again, this can be done in office. We have a Conway location that has a setup with a fluoroscope, which is a real-time x-ray that helps us with placement of the device. That can be done, as well as we do have access to surgery centers to perform this procedure for you. OrthoSC does not. The question is, does OrthoSC have their own surgery center? Because I'm a bit scared to go to the hospital. We hear you loud and clear. So in a matter of speaking, there are 2 surgery centers that are affiliated with OrthoSC, if you will. Carolina Orthopedics, who's one of the merged groups with OrthoSC, had already purchased and acquired a surgery center. It's called the Carolina Coast Surgery Center, which is at our location in Murrells Inlet. So there are no issues there. And then there's another called Carolina Bone and Joint that the physicians of Coastal Orthopedics have access to. And I believe some of the physicians from the former Carolina Forest location as well, that being Strand Orthopedics. So there are 2 surgery centers we have access to, so you would not have to have this procedure done in the hospital. Next question, are there any inherent risk or contraindications with the procedure or in the use of the unit? So number one, we would not perform this procedure if you were immune compromised or you were at risk for, higher at risk for infection than most others. Let's say you had a positive history of MRSA or a staph of some kind. There's an SRSA as well. In those particular situations, you would not be a candidate if cognitively you have some issues with dementia and things of that nature. You probably wouldn't pass the psychological evaluation that has to be done on all patients who are considering spinal cord stimulation. You have to have a psychological evaluation just to make sure that basic cognitive functionings are in place. And so those things would be contraindications to moving forward with the spinal cord stimulator of any kind, let alone HF10. Is the procedure completed under local or general anesthesia? And so it's a local anesthesia, but we are able to perform something called conscious sedation. Conscious sedation is performed or achieved, I should say, with Versed. Versed is a sedative, a mild sedative hypnotic that basically makes you amnestic for the procedure, and it also relaxes you to the point where you are able to respond to me, which I would need you to be able to do as well as the representatives from Nevro, because once the device is placed, you're immediately taken to recovery where the device is programmed properly, and you have to be able to respond to those things. And so you cannot be, or rather I should say, not that you can't be, but it's probably, if you wanted to be undergo general anesthesia to have this place and then be brought out of anesthesia, I suppose it could be done that way, but I have never performed the procedure, and most patients have done very well and have not had their entire day affected because they're coming out of general anesthesia. Next, is the procedure completed? Okay, I'm sorry, is it safe if I have MS? I don't feel that there are any contraindications in a diagnosis of multiple sclerosis, and I would say yes, provided there are none of the other contraindications like infection and that sort of thing, that having MS I would not have any pushback whatsoever with you having MS and being able to undergo this procedure. Are there any other questions? And so I would say, if in closing, if you are interested in knowing more about this procedure or feel that you have a diagnosis or a chronic pain issue that all other treatment options have failed, then we would encourage you to call OrthoSC to have an appointment with me, or you can reach out to the folks at Nevro. Charity is one of the reps, or just call our front desk and tell them that you heard this presentation and that you're interested in seeing either myself, Dr. Parker, or Dr. Aaron Watson for consultation regarding the stimulation, in particular HF10. And yes, can I call the office and set up an appointment with you? Yes, you can. And if you would, Lisa, did you guys, was there a particular protocol that, for the purpose of this talk, that you wanted folks to be able to reach out? Or Charity, is there something you guys want the folks on this panel to do different?
Sure,
to reach out to?
Yep, they're welcome to call the office and let them know that they attended the presentation today, and they can get priority as in regards to being contacted. You can also leave your information in the chat box here, and we'll follow up directly with an appointment for you, as well as if you RSVP'd to the site in advance, I will personally, I'm Charity, I'll send a follow-up email after this. But I only have the emails for patients that had RSVP'd prior to. So really, any way you reach out to us, we'll be happy to take care of you and get you then an appointment as soon as possible.
I have a couple of other questions here. Let me address that I missed. So could I explain if the battery has to be recharged, or if so, how is that accomplished? So the battery does have to be recharged, and it depends on the usage, how much of it, of the energy that you require based on the program set for you. But in general, we'll say that you need to recharge the battery once weekly. Would you say that, Charity? And that it's a Bluetooth situation just like the others?
Sure, yes. So for a majority of patients, we just recommend charging every day just because it's really short that way. It would keep the charge time under 30 minutes. And depending on the setting that you're on, just as you spoke to, Dr. Parker, some patients actually only need to charge every few days. And it is all done wirelessly. It's kind of like a cell phone charging pad that you just lay your cell phone on. You just place the little charging wand over the battery site, and it charges automatically. So it just daily charge, it just keeps it short. And if you charge less frequently, your charge time would just be slightly higher.
All right, next question. Are there any physical conditions that prevent using the HF10? Not really. I mean, if you're, I know there was a paraplegic question earlier. I wouldn't, it depends on what the problem is, and I'd certainly like to consult in person to find out if, to further determine whether HF10 would be useful or not. But MS, cancer diagnoses, heart conditions, diabetes, things of that nature would not be contraindicated in HF10 being considered as a treatment modality. Does insurance and Medicare cover this treatment? Yes. At what stage would you recommend, such as if surgery didn't help, is this the last type of treatment if all else fails and nothing else has helped? So again, I would say that if once you've had surgery and it's been at least 4 months, but probably upwards of 6 months, and it's just, you still do have this pain phenomena, that HF10 may be a solution. I would consult with your surgeon, however, because he or she may have other treatments in mind prior to considering something like this. But I feel that we would be, once you've healed from your surgery, that's really all we care about, and we would certainly be more than happy to consider you for this type of treatment. And then can we get a more detailed information on the trial study? Yes, we have information that can be brought, or rather obtained from our office in the form of a pamphlet. But Charity, do you want to speak more on this, where they might be able to find more information?
Absolutely. And you guys are all tech savvy now. So the easiest way is just go to www.hf10.com. So hf10.com is full of all the clinical data and our long-term outcomes. And it's great because it shows both the science as well as a very patient-specific, real patient stories that can help share the HF10 story. So hf10.com.
Okay. Another question, you may have answered this, but how long has OrthoSC been using this procedure? Well, OrthoSC has been in a merge group for a few years, but prior to that, I would say I had started to use the HF10 technology probably a year prior, and Dr. Watson, who is my pain partner at another location, even longer than that. But spinal cord stimulation, I've been doing greater than 10 years. Next, I have both spinal stenosis and a ruptured disc with numbness. The major issue in both legs. Will this help? It's possible that this would help. Obviously, there are no guarantees, but that's why we would perform the trial to see if it could give you some relief. And if so, then you would absolutely be a candidate to have the permanent device placed. But in times past, and in cases I can think of, patients with both spinal stenosis and herniated disc. Not sure if your disc is truly ruptured, because if it's ruptured, it would probably have been surgically addressed. But numbness and tingling and those kinds of things, the spinal cord stimulation as a modality would certainly help you. Will the device ever deteriorate in the body? No. Good question, though. That's something I might think about as well, but no. The only thing that is that we have to replace is, of course, the battery. When it's reached its lifespan, not because of deterioration, because of its inability to charge anymore, then we simply, and it's placed in the in a pocket is created in your hip area, much like pacemakers are placed under the collarbone. We create a pocket in the fat of the hip, make a small incision. The battery is slid in there, and the wires are hooked up, and it's closed by with sutures and or staples. When it's time for the battery to be replaced, the same thing happens. We simply open that area again, remove the old battery, place a new battery in, and close it back. Next, is it safe? Okay, we answered the MS question already. Does this device help with arthritic and stenosis type pain? Yes. Next, how would this affect you with other surgeries or care? It wouldn't. Even if, let's say, injections didn't help, rather, you determined that you did not want to have a full-on back surgery, and you decided to have the HF10 placed, only to have another condition develop later and require back surgery. Having this device in your body would not prevent you from having any surgeries. As a matter of fact, if the device had to be removed to perform some other procedure, then that could occur. All right, so I think that's all the questions in the question bank from the raised hands. Let's see. And yep, there's another question. Hang on. Let's see. I think everyone's seen that the presentation will be uploaded on the website by Wednesday. Am I able to sleep in any position, drive, or play with my grandchildren without having to really worry? Yes. With traditional spinal cord stim, we always ask what side you sleep on, because that determines where the battery is placed. But with the HF10 technology, that's not as much of a concern. And yes, the video will be available for future viewing. Does this procedure help with sciatica? It potentially can. We have a patient, initials FST, and states that was my first patient because of the virus. Have not, let's see, hang on, not heard from the rep David since March, and I need the stimulator to be reprogrammed. Someone from the Florida office is supposed to see me at my primary care doctor, pain management physician, Dr. Sawyer, and they're having trouble getting contacted. So Charity, are you able to see the Zoom webinar chat?
Yeah, I sure am, and we'll certainly look into that. We don't have a gentleman by the David that works here, but I will definitely follow up on that.
Okay. They may be talking about the stem wave, now that I think of it, but I'll let, yeah, they may be talking about stem wave.
That's a completely different therapy.
Mm-hmm. Right. All right, so we will reach out to this patient, and let's see what else we have.
Yes, I think they just confirmed it was stem wave.
Okay.
They did.
Yep. Can we let Tracy or Daphne know that, please? And because we have just been approved for that.
Yes, Dr. Parker, I will make sure they know this.
Okay. Let's see. Okay. Is there anything else? Okay. I don't see anything else. Let me just do one more shot here. Okay. I think that's it. So everyone, we thank you for attending today. And if you need us in the future, please reach out as soon as possible. I will be out of the office in particular until near the end of August. So, but I'll be back around the 23rd of August to see anyone who might need. But in the meantime, certainly Dr. Watson or anyone else in our office can at least get the process started so that when as soon as I return, we can get started on your care. Thank you very much.